Hello everyone. Welcome to the channel.
Tiny bumps around the eyes or cheeks, are they milia, or are they syringomas? Both conditions appear very similar, which is why people often get confused, but in reality, they are quite different. In this video, we will compare milia versus syringoma, step by step, so that we can spot the difference with confidence.
Let's begin.
First and foremost, we have to keep in mind that we should not confuse milia with miliaria. Miliaria, or heat rash, is caused by blocked sweat ducts.
It appears as small, red, itchy papules or blisters and is triggered by heat and excessive sweating.
It can show up anywhere on the body, especially in skin folds.
Cooling the skin is the best way to treat it. Hopefully we will discuss miliaria or heat rash in the future. Now let's try to differentiate milia and syringoma.
Let's begin with what they actually are. Milia are small keratin-filled cysts. They form when dead skin cells or keratin get trapped just beneath the surface of the skin. Syringomas, on the other hand, are benign tumors of the sweat ducts. That means they are tiny overgrowths of the eccrine glands, which are responsible for sweat production, so milia are cysts, while syringomas are glandular growths. Milia are 1 to 2 millimeters, white or yellow, dome-shaped papules. They have a smooth, pearl-like surface and are usually scattered. Syringomas are slightly larger, measuring 1 to 3 millimeters, and are skin-colored to light brown papules. They are firm, flat-topped, and often appear in symmetrical clusters, especially under the eyes, so if you notice bright white, pearl-like spots, think milia. If you see multiple, skin-colored clusters, think syringoma. Milia can appear almost anywhere on the skin, such as eyelids, cheeks, forehead, nose, and even inside the mouth or gums of newborn babies. Syringomas, in contrast, have a strong preference for certain areas. They are most commonly found around the lower eyelids and upper cheeks, but can also occur on the chest, abdomen, armpits, and genital area.
Milia can affect people of any age, from newborn babies to adults.
They may develop spontaneously or after burns, injuries, or cosmetic procedures.
Syringomas often appear during adolescence or young adulthood, and they are more frequently seen in females.
These growths can sometimes be genetic and may also be linked to certain conditions, such as diabetes mellitus and Down syndrome.
Milia are harmless and painless.
They don't itch, they don't spread, and most will disappear on their own within a few weeks or months. Syringomas are also harmless, but they do not go away spontaneously. They tend to persist for years. In some cases, they may cause mild itching, especially when the person sweats.
Milia often need no treatment at all.
If removal is desired, a dermatologist can extract them easily with a sterile needle or a tiny incision. Syringomas, however, are much more stubborn. Because they are embedded in the sweat duct, removal usually requires electrocautery, laser, or chemical treatments. Even then, they may recur, and treatment is mostly done for cosmetic purposes.
Now let's quickly recap what we have discussed today.
Milia are pearl-like temporary cysts that typically resolve on their own.
Sometimes it can be stubborn and may require intervention.
On the other hand, syringomas are skin-colored permanent clusters of sweat gland growths that require cosmetic procedures if they are bothersome. Hopefully, these discussions helped differentiate milia from syringoma. If you found this video helpful, don't forget to like, share, and subscribe for more of the same.